Hello and welcome to Ray Cochrane Aesthetic Academy. I would like to introduce you to our Advanced Aesthetic Skin Peel and Skin Needling course. The course is 12 weeks course. Like on the 12th week, the learners will have their practical examination. We're gonna cover a lot of theory, but we will start with skin peeling treatment. And we usually do full demo of that treatment from the beginning to the end, and with full consultation as well, and full skin assessment, which is really important. So we take different models and they, assess the skin. So that's going to be demo for the demo to the learners, and then we after that we have like some weeks of practice, and then we carry on with skin needling. Full demo of skin needling treatment is shown with full assessment if that's the client suitable for that treatment or not, so they really understand that. We also have a day for advanced skin analysis. So we have a like skin analysis machine that is actually a new addition to our family, and it's really good to show the learners something that advanced, that you can see all the skin concerns, all the issues under the skin layers, so you can see like what actually we will be working on. So this is also additional to the course, is something extra. They will learn as well advanced extraction. Advanced extraction is not part of the syllabus, but they will learn that. We will do full demo of how to actually extract blackheads and whiteheads with a needle, disposable needle. And this is very important to sometimes do before skin peel, especially if you feel that skin is quite congested. But if you just do the peel, it's not going to be as good as if you actually extract the skin first, then do the peel, then maybe do the needling after that. Then you're really going to see the amazing results of the treatment. So there are a lot of little things and little tips we're going to give the learners. Our learners, all our trainers are very advanced. They have done those treatments for many years, and they've seen amazing results, and they're very much hands-on. So they perform those treatments. So I'm actually the main teacher when we're talking about skin peeling and skin needling course, and I've got my colleague Maria that helps me with the training as well. We have a lot of theory included with the course that we cover in class, and that theory will include anything you really need to know in terms of advanced aesthetic treatments. So we not only cover the skin peeling and skin needling treatments, but also we teach them how to combine treatments, how to combine those two treatments first of all by themselves together, but also how to combine those treatments with other treatments like laser, IPL, skin rejuvenation treatments, or anything else they usually have learned with level 3 beauty, any electrotherapy. So they're really going to have a lot of understanding of how to combine treatments, because some machines, some lasers, some devices are working on different layers of the skin. So they need to really know, okay, we can combine those three devices and we can do treatment on the same day. We can actually do those 3 treatments on that customer and achieve much better results, but they need to understand why and how is that possible. Why would you actually give those results? It's just because they're working on completely different layers and structures within the skin, and you can actually benefit, clients can benefit even more. So also in the course, we really very closely look at different skin disorders like pigmentation, but also what type of pigmentation. They're gonna learn a lot about melasma, a lot about skin sun damage, a lot about age spots, because they're completely different type of pigmentations, and they have to understand that in order to perform those treatments and really treat the customers and give them good results. Because if they don't understand what type of pigmentation actually customer has, they probably wouldn't be able to treat it properly with the correct treatment, and they actually can make it worse. Very closely we look at the rosacea and acne rosacea. Again, a condition that is very common in nowadays. We discuss what treatments we can do for that condition, when we should not treat the customers. If they have, for example, rosacea, what are the triggers for rosacea? What we need to advise the customers to advise. We need to look at the actual problem. We need to look at what is the cause of the condition. So we always have to look for this in order to actually address the problem and treat them. We're also going to mention about acne and acne scars. It's very, very common condition we treat. As a very advanced aesthetic practitioner, I have to tell you that it's probably one of the most common conditions, and they have to learn what skin peels to use on clients with acne, what are the best peels to use on clients with acne. and you know, why we can combine them like that, why that's going to give them best results. Of course, sometimes we have conditions like combination. For example, we have customers that come with rosacea, but also on top of that they have acne as well, plus acne scars and a little bit of sun damage in form of pigmentation, and then we need to address that properly and treat them with the correct products. So all those things, they're going to be included within the course. So a lot of advanced training connected to any skin conditions and common skin problems, but also they will learn all the acids. When you're talking about skin peels, we're talking about different acids that are actually addressing different skin concerns. So this is just like 1/3 of the peels we are using here. Salicylic, glycolic, mandelic and lactic. These are mono peels, we call them, and the learners need to know how to use mono peels by themselves only, and then they also are going to be practicing on combination peels. And you can see that they have different percentage. And also on the boxes usually I put for them the pH of each peel and also the skin type they can use it on. Is it skin type 1 to 6? Is it they can use it on darker skin or not? But more or less from all the ranges they can use peels on all the skin types. Like some peels might not be suitable for darker skin types, but most of them will be able to, so some of them will be able to use it on darker skin, so they need to know which peel they can use, they need to know how to follow the protocol, and those acids, they need to know where they're coming from, where they're extracted from, what is the effect on the skin, which acid is better for what skin type and for what skin condition. We are teaching them about AHAs and BHAs, alpha hydroxy acid and beta hydroxy acid. We are teaching them about TCA peels, how long they should leave the peel on the skin, when they should really remove the peel if they see something is going on a bit earlier, what is the effect on the skin, the different percentage, the different pH of each acid. Why would you remove the acid earlier than, for example, it says in the protocol, what is the endpoint we're looking for. So there are a lot of things that are, very beneficial and they need to learn, and it's super important when you perform treatments of those sort of treatments. When we talk about the skin needling as well, they need to know the correct depth of the needle, they can go through the correct technique, which client is suitable for treatment. For example, clients that are prone to keloid scarring and they have keloid scars, like we cannot perform the treatment. If clients are pregnant, customers are pregnant, we can't perform the treatment. There are a lot of things that can, some of the customers can be contraindicated to that treatment, that they need to know that. But the most important is to actually identify the problem, the skin problem, the condition we are going to treat, to recognize it, and to choose the best treatment for it. So this is all included in the course. They also combine treatments. To enroll in that course, you need to be level 3 qualified or equivalent. If you have any questions, you can just contact us, contact our girls. They are very familiar with everything. They can explain you what exactly is the course about and just give you more information. But everyone can do the course, and you can really be, that's the highest qualification for skin peeling and needling, and you can perform those treatments. You can, open your own business, you can work as a mobile practitioner, you can work in a big, practice, and, even work beside doctors as well. So it's a lot of opportunities, a lot of doors are open. This course is government approved, government recognized, and is fully insurable course. That means that you can obtain your insurance once you graduate from the school. Once you have your certificate, you can be fully insured. And of course, what qualification you must have and is requested by the local authority or the council. This is what they are asking for. So it's a VTCT level 4 advanced aesthetic course, including skin peeling and skin needling. It's exam-based course, so during the course you'll be prepared fully for your exam. You need to do case studies in the school, so all the case studies, all the models you'll be working on are going to be counted as case studies towards your exam. So, and then you have to attend your exam. So we have examiner coming externally, she comes, she examines you, and she usually is the one deciding if you are competent or you're not competent. So So we had an amazing feedback from VTCT examiner and ITEC examiner, saying that, you know, these are like probably one of the highest standards, like one of the highest she's seen in the industry. So which is really good. So absolutely amazing, very, very well prepared, our learners, and they did an amazing job, and they all passed actually last time. So very, very happy with the progress we're doing. We also give our learners small student kits. They have like sponges inside, some kind of creams that will help you with healing, a little bit of product, some funds, like just a few things inside that will, you know, they can use throughout the course. One of the most important things, of course, we teach you is hygiene and safety. When examiner comes to examine you, those are the two things she'll be looking for mainly. It's actually hygiene and safety. So, of course, she'll be looking for treatment, you know, how actually perform the treatment, if it's good, if it's, and if it's the correct treatment for the correct skin type, the skin assessment, but probably one of the main one they're looking for is safety. So really safe treatment and really hygienic. So the area we're working should be absolutely sterile. Where possible, we should use disposable products, like we do use as well, like hairnet, disposable. We use mask, aprons, make sure that we use uniform that is clean, tidy, hair needs to be tied back, no really jewelries, like not in here, just really clean, like it should look very professional when you perform those treatments. So first impression when customer come and see the therapist or practitioner, they must feel very confident, they must feel that they can trust that person, because the treatments we offer are, you know, more into the medical side. We are dealing with blood as well, you know, during microneedling you may have some blood, so it's very important to dispose our waste into the proper container for that. So those things are like one of the basic and the most foundational ones that we really have to focus on in the beginning, and we do that, and really our learners are trained to absolute high standard. That's the reason actually we have a lot of companies. One of the biggest clinics, Melasma in UK and London, come to our school, and they want practitioners, they want therapists from that school, because they know the quality of training we provide, they probably wouldn't, you know, actually find anywhere else in the industry here. Yeah. So thank you so much for watching, and then I hope you will join us, and I'll see you in my next course. Thank you.